Hi guys, so in today's lecture we will talk about brainstem syndromes. In this particular lecture we will mainly focus on three organs of your body. First will be eyes in relation to midbrain syndromes, second will be face in relation to pontine syndromes, and third will be even more important, a multi-purpose organ, that is your tongue, in relation to your medullary syndromes. In case of midbrain syndromes, there can be down and out deviation of eyes due to involvement of third nerve. In case of pontine syndromes, there can be facial palsy due to involvement of seventh cranial nerve, whereas in case of medullary syndromes, there can be involvement of hypoglossal nerve resulting into ipsilateral deviation of tongue as well. This tongue is a multi-purpose organ. Apart from taste sensing, apart from mastication, this has endless number of job to do. Due to scarcity of time in this lecture, I cannot enumerate each and every job of tongue, but this tongue can also help your marriage last longer. Let me explain it. Guys should restrict use of tongue and they should only use it to say sorry more than often, and ladies should also restrict its use by speaking less. So let's start. Now let's discuss midbrain syndromes. Again, you can appreciate blood supply of brain, and here you can appreciate your posterior cerebral arteries. Having understood blood supply of brain and brainstem along with circle of Willis, now you guys understand blood supply of various parts of brainstem. So having understood the vertebral arteries, having understood the basilar arteries, now this is turn to understand your posterior cerebral arteries, which will be supplying your midbrain. So any problem related to posterior cerebral arteries will result into midbrain syndromes. We will discuss various midbrain syndromes, particularly your Weber syndrome. So in this case, there will be problem related to your P1 part of your posterior cerebral arteries. This is P1 and this is P2, and this is your posterior communicating artery. We have already understood this concept in our discussion on circle of Willis. So in case of midbrain syndromes, we will mainly relate all these things with posterior cerebral arteries. So in discussion on midbrain syndromes, we have to focus on third cranial nerve. We have already understood that in case of medullary syndromes, we focus on 12th cranial nerve. We look for the deviation of tongue, that is ipsilateral. In case of pontine syndromes, we mainly focus on facial nerve and we mainly look for facial palsy. Similarly, for understanding of midbrain syndromes, we mainly focus on third cranial nerve. Okay, and what will be the manifestations? Due to involvement of third cranial nerve, there can be ptosis, there can be loss of light reflex as well as loss of accommodation reflex, and particularly in this case there will be deviation of eyeball, down and out eye, because in this particular case there will be unopposed action of lateral rectus, that is LR6, and there will be unopposed action of superior oblique, that is your SO4. So these muscles will take your eyeball down and out. So these will be manifestations of third cranial nerve palsy. Here you can appreciate the ptosis, this is your ptosis, and here you can appreciate your eyeball going down and out. And because there will be absence of light reflex, there will be absence of action of sphincter pupillae, therefore it will result into dilated pupil, that is also known as mydriasis. So in case of midbrain syndromes, there can be involvement of third cranial nerve palsy, and because brainstem syndromes are related to crossed hemiplegia, so in majority of midbrain syndromes, there will be ipsilateral third cranial nerve involvement along with contralateral hemiparesis. Too simple to understand. Here you can appreciate cross section of your midbrain. On the dorsal aspect, you can appreciate the tectum, and on the ventral aspect, you can appreciate the crus cerebri. Your corticospinal tracts are related to your crus cerebri, whereas over tectum you have pineal gland over here. So any problem resulting from pineal gland will result into dorsal midbrain syndrome. Okay, we will discuss. And which is major artery in this particular part? You have posterior cerebral arteries. Okay, so let's discuss further. Here you can appreciate dorsal part, which is related to your pineal gland. On the other hand, you have ventral part, and this is your crus cerebri, and this is related to corticospinal tract. Apart from all these things, you can also appreciate the third nerve nucleus. You can also appreciate the red nucleus over here. So in this discussion, we will involve cranial nerves 3 and 4, and we have understood that the cranial nerve nuclei of 3rd and 4th will be present in the midline. So what are the structures present in this midbrain? Here you can appreciate your 3rd cranial nerve, and here you can appreciate your 4th cranial nerve. Here you can appreciate the pineal gland. Here you can appreciate the crus cerebri. This is your crus cerebri, and these will be related to your corticospinal tracts. So these are your corticospinal tracts. Any problem resulting from this corticospinal tract will result into contralateral hemiplegia. Now try to understand. There will be red nucleus somewhere here. Along with this, also try to understand there will be your superior cerebellar peduncles. Okay. Now, this is your superior cerebellar peduncle, and this is your red nucleus. So, in this case, there can be involvement of corticospinal tract, involvement of 3rd and 4th cranial nerve, along with superior cerebral peduncles, along with red nucleus. Now, understanding midbrain syndromes will become very easy. Try to understand. This is again cross section at the level of your midbrain. Here you can appreciate red nucleus, and here you can appreciate your cranial nerve 3 nucleus, and along with the nucleus of cranial nerve 3 you have also cranial nerve nuclei of 4th cranial nerve. Along with this, you can also appreciate substantia nigra, and at the level of crus cerebri you can also appreciate corticospinal tract. Apart from this, you also have superior cerebellar peduncles. Okay. Now, in this particular case, main syndrome will be your Weber syndrome. In case of Weber syndrome, there will be involvement of cranial nerve 3, that is always cranial nerve involvement is ipsilateral, along with contralateral hemiplegia. So in case of midbrain syndromes, if we are dealing with Weber syndrome, it will be mainly related to your cranial nerve 3rd involvement along with hemiplegia. And what will be the manifestations of involvement of cranial nerve 3rd, we have already studied. Now try to understand. We are already done with Weber syndrome, that is ipsilateral 3rd cranial nerve palsy along with contralateral hemiplegia. Now we are left with Claude syndrome, Benedict syndrome, North-Nagel syndrome, and Perinaud syndrome. This is very easy. In case of Benedict syndrome, there will be involvement of your red nucleus. Therefore, in this particular case, there will be problems related to your basal ganglia. Therefore, in this particular case, patient might have chorea, patient might have resting tremor, right? But in this case, there will be no hemiplegia. So in case of Benedict syndrome, due to involvement of red nucleus, patient will experience chorea, patient will also experience resting tremor along with ipsilateral 3rd cranial nerve problems. Okay. Whereas in case of North-Nagel syndrome, there will be involvement of superior cerebellar peduncles. Therefore, in this particular case, patient will have ataxia because cerebellum is related to ataxia. This patient will have intentional tremor because in this particular case, there will be involvement of your cerebellum, and also there will be involvement of cranial nerve 3 resulting into 3rd cranial nerve palsy resulting into down and out eye. In this case, you can appreciate that there will be involvement of superior cerebellar peduncles resulting into ataxic gait. So, in this case, you can appreciate that Benedict syndrome is involving red nucleus. So, instead of writing Benedict syndrome, you can write this particular thing as Brednick syndrome. So, in Brednick, you have your red nucleus, whereas in North-Nagel, you can appreciate AG. This AG is related to your ataxic gait. Okay. And what is your Claude syndrome? Claude syndrome is combination of Benedict plus your North-Nagel. Now I suppose you guys can memorize Weber as primary syndrome of midbrain, and then you have Brednick syndrome, and then you have North-Nagel syndrome. Brednick instead of Benedict, and in North-Nagel you have ataxic gait. Therefore, it might be involving superior cerebellar peduncles resulting into ataxia and intentional tremor. Now let's talk about last syndrome related to midbrain, that is known as Perinaud syndrome. In this Perinaud syndrome, there will be involvement of pineal gland as well along with dorsal aspect of midbrain. Try to understand, this is dorsal aspect of midbrain and this is ventral aspect of midbrain. This is your dorsal aspect of midbrain, and in dorsal aspect of midbrain you have pineal gland relations as well. This is your pineal gland, and this particular syndrome is mainly related to pediatrics, mainly related to your pineal gland, mainly related to your pinealoma. If there will be presence of pinealoma, there will be enlargement of pineal gland. This enlarged pineal gland will also compress on your superior colliculus as well as your tectum. Now, due to this compression, there will be many problems. Particularly, there will be vertical gauge palsy. And in this vertical gauge palsy, mainly there will be problem related to upward gauge. And this will result into sun setting sign. Sun setting sign. I have also shown a diagram over here. Here you can appreciate that eyeball has moved downward. This particular thing is known as sun setting sign because there will be pressure over superior colliculus and tectum. Now in this particular case you can appreciate the presence of third cranial nerve, and in this particular case due to involvement of pineal gland, supranuclear fibers will be affected. Therefore third cranial nerve functions might increase in this particular case, and therefore this can be related with lid retraction due to overactivity of your levator palpebris superioris. In this particular case, there can be other manifestations in form of your Argyll-Robertson pupil. In this particular case, light reflex will be absent, but accommodation reflex will be present because there will be problem with pretectal nucleus as well at the dorsal aspect of your midbrain. So pretectal nucleus will be affected, resulting into loss of light reflex, whereas accommodation reflex will be present because Edinger-Westphal nucleus will remain intact. So this is your Perinod syndrome related to your pineal gland. So this is your Perinod syndrome starting with P from the posterior or dorsal aspect of midbrain, and this is related to your pediatrics, and this is related to your pineal gland tumor. And mainly in this particular case you can have sun setting sign as important clinical finding along with lid retraction particularly due to over functioning of third cranial nerve due to loss of supranuclear inhibition due to presence of this pinealoma. So that's all about midbrain syndromes and brainstem syndromes. I hope you guys understood the concept as well as the simplest approach possible for the understanding of brainstem syndromes. Bye bye, take care.